Welcome back, everybody. We continue our focus on heart health this week. You know, heart disease and stroke remain two of the top two killers of Americans, according to the American Heart Association, and they pose a significant threat to millions of others.
You know, I sat down with a health expert this week, and here's what you need to know to help you bounce back from a heart event.
I was experiencing chest pains and arm pain and jaw pain. It was like a pain I had never experienced before.
To look at Becky Griffith, you wouldn't know that 3 months ago she had a heart attack.
I have one stent put in my main artery that was completely blocked.
Becky's November 7th heart attack is what healthcare professionals describe as phase 1, when a patient has a heart event in the hospital. Now on her road to recovery, she is now taking part in phase 2, cardiac rehab at Memorial Medical Center.
Take a look at what risk factors might have influenced your health. So we'll look at, with a patient, we'll kind of have them do a little self-assessment.
You know, you get busy being a mom and you kind of slip away. And, you know, it was easy to do.
Becky says not paying attention to her diet was a big contributor.
Like eating out too much, mindless eating, you know, picking up snacks the kids may have, things that are not healthy for us.
And speaking of making the right choices, knowing the fat content in your food is very important. When you're hungry, you normally grab a snack. That Snicker bar has 13 grams of fat. A bag of chips, 10 grams of fat. That donut you grab in the morning, 20 grams of fat. But fruit and vegetables, health experts say the best choice, 0 grams of fat.
Knowing where to begin is important.
Acceptance, taking accountability for, you know, changing their health, and then just kind of getting started.
Becky admits also she didn't exercise as much as she needed to, but that all changed in phase 2.
In this particular program, the patients have had their recent event, and then they come here for their exercise, their monitored exercise program.
Becky is one of 60 to 70 patients who take part in the supervised 8 to 12 week phase 2 program at the Cokie Mill location.
They have confidence in their ability to exercise, to increase their endurance, increase their activity, know that they're not going to have symptoms while they're being active or exercising.
And learning valuable life lessons that address a lot of the risk factors that led to their heart event.
They also gain a lot of information on blood pressure control, cholesterol control, managing diabetes, helping patients to stop smoking, making much better choices in their diet.
I was at a conference where a statistic popped up that said only 1 in 7 people change their life after a heart attack. Well, I want to be that one because I don't want to have to go through this again.
Healthcare professionals say patients who fail to make the necessary changes put themselves at risk.
If you don't make those lifestyle choices, there is a strong possibility that you could have another heart attack.
So, having a bypass or stent is not enough.
So now we need to take a look at what's going to make sure that that stent stays open, that that bypass is not going to be a problem, you know, that you're going to continue to have good health.
These days, Becky says she's putting herself first so that she can be a healthy mom, wife, and business owner.
You cherish every day. You don't sweat the small stuff. You want to get up and exercise because you know that's going to help heal your heart.
You know, if you have had and suffered a heart event and you don't know where to begin, first, make sure that your cardiologist has released you to begin cardiac rehabilitation. Second, take your medications as prescribed. Then start moving by walking and try to sit less. It also helps to take a tour of your grocery store and start reading labels. Finally, take a look at those risk factors and make the necessary changes to eliminate them from your life for good.